Good afternoon. My name is Laura Gonzalez and I'm one of your instructors for the Math Search course. What we have today is just a demonstration on how to prime a solution with primary tubing that belongs to the Alaris pump. I'll be showing you later on how to program the machine so that we can deliver the correct amount of fluid per hour. To begin with, I would like to say that we need to obtain the equipment. So of course, we're going to have to check against our medication record, the doctor's orders about the solution that needs to be infused for the patient. So in the case of this order, we have lactated ringers. It's 1,000 cc's that will have to be infused over 7 hours at 75 cc's per hour. Okay, the expiration date is March of 2019. What we also have is just the tubing that belongs to the Alaris. So, okay, when you're grabbing your materials, just make sure that you have the correct equipment. So we have it. We're looking for the integrity, and if there's an expiration date, making sure that it's not expired. We have labels that we'll be using to label our solution, okay, as well as labels to add to our tubing, which should be changed according to policy. Different facilities have different time frames for changing, so we can go ahead and go with the policy and change probably every 72 hours is just the most common. Okay, but remember, you have to go with your facility. Well, I have this container. This container should be clean. Okay, should not have been used, and this is so that we can use it for any fluid that might come out of the tubing when I finish the prime. Right now, what we have is a solution that we talked about is lactated ringers. Again, I'm just making sure that the bag is intact, and once I dispose of it, I'm gonna assess my solution for clarity, for consistency. Should not have any particles, and I'm going to hang it on my IV pole. Then I'm going to proceed to label my solution. Lactated ringers, 1,000 cc's, and it was hung today, October the 16th, 2018 at 1400. My initials, of course. Then I'm going to proceed to utilize my primary tubing. Again, the packaging should be intact, not expired, and I'm going to open it. First thing that I need to do once I open it is just make sure that I clamp the roller clamp that is here, okay, to prevent too much fluid from coming out of the tube when I prime the tubing. Second, what I have to do is just go ahead and loosen up the end, the distal portion, okay, cap that we have here, just so that we allow fluid to come through the tubing. And I can remove this part. We don't need this. I'm going to bring my mark, okay, and I'm going to compare again. Okay, so I have lactated ringers. Okay, lactated ringers is 1,000 cc's, and the expiration date is March of 2019. I'll be removing the cap here. And then I'm going to spike. When I'm spiking, I need to be very careful not to contaminate the spike. So you can grab the end of this port and then spike and then twist until you have your port fully seated. Okay. Squeeze your chamber. You have to have 1/3 to a half full. And then you can go ahead and begin to prime your tubing. And how is it I'm going to do this? By opening the clamp, okay? And what I'm going to see is the dripping of the fluid, okay, in the chamber as I am priming the tubing. I'm watching to see where the solution is coming. When you have a port, you can invert just to allow that fluid to flow freely, okay? If you happen to have an air bubble, you can always flick it so that it moves towards the distal part of the tubing, and at the end, all the air should have come out without you wasting more than a few drops of solution. Why is this? Many of our solutions have electrolytes, like potassium, for example, that is added to the solution. Sometimes we have medications, and if you were to waste too much fluid, then also you are wasting the medications that have been added to the solution. With that being said, then we are not giving the correct dose to the patient. Okay, so we have a little bit of air coming out, okay. And I stopped my priming right now because I have some bubbles here towards the end. And if I was to keep the clamp open, then I would end up wasting more fluid than I should. I'm going to remove this cap briefly, okay? Make sure that you do not contaminate, okay? Okay, we need to recap to avoid any possible contamination of the tube, and we're going to set it aside. We can hang it here, okay? And as we're doing it, what we need to do is just go ahead and label our tubing. So again, date, time, and my initials. Before I continue, I will have to set it up on my machine. So open your machine and load your tubing in it. So if you follow the structure of the machine, it will tell you pretty much where to go and what to do. So this blue clamp goes in. Okay, let me see, it's right here, and the rest of the tubing sits here. With that being said, blue is here, then you have the clamp here, and then you're going to close. Make sure that your clamp is open. Okay, at this moment in time, no solution is going to run. Okay, and what we're going to do is just turn on our machine. Okay, system on. And the machines will guide you to the next step to be taken. So be patient, okay, and just read what the screens are telling you, and you will find it less confusing. So we're gonna go with no for no new patient, medication. I'm sorry, med surge. Yes. Okay. Okay. Yes. And then we're gonna select the channel. The channel is this portion. So it has to select the channel. Okay. So channel select, and it turns it on. Okay. Right here, what we're gonna work with is just a basic infusion. So we're gonna click on it, and it's gonna give us the rate that we should be infusing the solution, as well as the total amount that we have on the bag. So the rate, we said it was 75 cc's. Okay, so the rate is 75, I'm sorry, okay, right here. And then for the primary, 950, although we have 1,000, we would like to leave a little bit of a leeway so that that bag doesn't run empty while we go back to the patient's room. So 950. And then we're gonna proceed to start. So everything is on the screen. Okay, and that's how you work out your machine. At this moment in time, I'm going to stop it because I'm going to proceed with the venipuncture. I'm going to show you how to start an IV. Okay, now we're going to proceed to start an IV site, or in other words, as your packet mentions, is a venipuncture site. So for that purpose, we need a list of items that we're going to be using. And at the beginning of this, as you are bringing the materials or the items to the patient's room, make sure that you work on a clean surface. So it's very important for us to use any disinfectant wipes. I have some Clorox. The hospitals might use different wipes that are disinfectant, so you need to go with the agency's requirements or policies, and then you're gonna decontaminate the table. Usually the table is what we use most of the time to start an IV, to set the materials to begin an IV. Okay, so while I let it dry, I'm gonna go ahead and do hand hygiene, and then I'll be showing you the different items that you need for the venipuncture. To begin with, you need your gloves. Make sure that you have the right size. Okay, so these are disposable. Also, you can have a towel or even a chalk. These will go underneath the patient's arm just so that we can catch any blood that might run out of the IV site. Then we have the different angio catheters that are available right now for the purpose of the demo. I just have number 20s and number 22s, but there are some other catheters that are either larger or smaller in size. So we have the number 20, and then we have number 22. So remember that the larger the number, and the smaller that the needle is. Okay, so the 22 is smaller compared to our 20s. Okay, I bring enough to the bedside just in case if I need to repeat the venipuncture, that I'll have an extra needle for the patient. I need an IV connector or extension. Okay, also it's called a piggy tail. I'll show you how to work it out with it when we're starting an IV site. I have saline. This comes pre-packed, and what we have to do is just make sure that we check, of course, for the expiration date. So right now I'm checking for the expiration date, and it's 10/30 of 2019, so it's good to be used. We have the IV start kit, okay, and this has the VeniGuard, okay, it has a chlorhexidine, and this is what correctly is been used in most hospitals, if not all. The tourniquet, and I'll show you what it is, and also tape. I will begin by preparing my materials for the IV insertion. So this is the IV start kit, and what I'm going to do is real quick, I'm going to go ahead and open it. Okay. And inside, what we're going to find is our tegaderm that will go over the IV site. Okay, I can leave it here on the side. Then I have my tourniquet, the chlorhexidine, and also a 2x2, as well as some tape. So the tape, I will need a piece of it just to secure my IV site once I finish inserting the needle. Okay, right here, and then we can leave it here without any problem. And then I have my chlorhexidine. Okay, so now that I have my IV start kit ready, I'm gonna go ahead and proceed to go ahead and prepare my extension set. This is a pre-packed normal saline. Okay, when we remove the wrap, just make sure that you remove also the cap without contaminating, so that you can go ahead and prime your extension set. When we are removing the extension set from the package, and just make sure that you do not contaminate the end. So I'm going to connect the end, okay, and I'll make sure that this is a little loose just to allow for the saline to flow free into the extension set. So right there we have it primed, and we can leave it right here in a secure place where it's not going to fall and it's not going to get contaminated. I'm going to go to the patient's side and I'm going to introduce myself. I'll ask for their name, their date of birth. Okay, then I'm going to proceed to go ahead and assess my patient's extremity and looking at the veins that are available. So we prefer to start an IV on the side where there's not flexion, like for example your antecubital area, and neither the hands, because we utilize them a lot. However, if there is no other vein available, I will go ahead and use the vein in the left hand in the case of my patient. I'll make sure that I go over the vein and apply gentle pressure, just making sure that it blanches. When the vein blanches and then reappears, it means that it's suitable for venipuncture, and more likely I'll be successful with leaving the angiocatheter on my patient and not having any problems with the vein. I will be preparing my patient skin then with chlorhexidine. I'm going to break the seal and I'm going to begin in a single motion, okay, for 30 seconds. Okay, you can go ahead and do this, and then you can go in this other direction, okay, from left to right in the case of me doing this, okay, and then again. Okay, so while I waited for the skin to dry, I will put my gloves on, and then I'm gonna go ahead and apply the tourniquet 4 to 6 inches away from the insertion site. Make it snuggle, but not too tight where you're gonna cut the patient's circulation. And you need to make sure that there's a radial pulse. So if there's a radial pulse, then you're gonna begin to insert the needle. As you are removing the cover, make sure that the catheter is intact, and also we're going to look at the bevel up. Okay, you should be bevel up, and I'll begin by inserting the needle. Okay, hold still please, Mr. Jackson. You're going to feel a prick. Okay, there's a flush back. Can you tell the blood? As soon as you get the blood return, you release the catheter. I'm sorry, the tourniquet, I mean. So you're going to lower the needle and you're going to begin to push in as you pull back, okay, in a single motion. So if you can see what I'm doing, okay, until you hear a click. That means that your needle is secure, it's protected, and it's ready to come out. Okay, I'll be placing a 2x2, just making sure that when I remove the needle, there's any blood that might come, I can catch. Okay, it goes in the sharps container. There's a little bit of blood coming, but I'm catching it in the 2x2. Oh my God, okay. Here you go. Can you see? It happens. It happens. So, but as long as we catch it, should be fine. Okay. You clean your patient very well. And right now what you're gonna do, you're gonna pull back just to verify that there is blood return. We have an excellent blood return on Mr. Jackson, and then you're gonna go ahead and flush it. As you're flushing, you are verifying that your patient is not having any infiltration. Also, you ask your patient if there's any burning or any other abnormal sensation that was not there before. Mr. Jackson, how are you doing? Are you having any pain? Does it hurt or burn? No? Okay, perfect. Thank you. We're almost done. You can remove the syringe, or you can leave it right there just for the purposes of avoiding contamination. Okay, you're going to tape your IV side loosely, and then you're going to proceed to apply the Tegaderm. The Tegaderm has a slit. The slit has to go downward to where the color coated needle is. Okay, you're going to apply it in this fashion. Okay, you remove the paper that comes with it. Okay, and you save it because we're going to have to date and time and also initial. The label is ready, and I'm going to go ahead and apply it to my IV site. Remember, this should not obscure the IV insertion. You can place it on either side, okay, of the IV. With an extra piece of tape, what you are going to do, you can go ahead and secure then your extension set. And right now, we can go ahead and remove the tape that we utilized at the very beginning just to secure the place while we were working on dressing the IV side. I'm going to remove the syringe, and without touching the end portion of my extension set, I'm going to go ahead and connect my IV fluids that have been ordered for Mr. Jackson. I want to have a few words for you that are very important when we are dealing with patients and that are in need to have an IV site. So please refer to your packet under special notes on intravenous therapy. Very, very important that you check your patients for mastectomy, for previous CVAs or strokes. Make sure that you assess your patient in case if they have access for dialysis, burns, or any other skin integrity problems. Tattoos are also important, so we avoid those areas that are heavily tattooed because it makes it difficult for us to assess the IV sites. Remember to instruct your patient to call you if there's any issues with the IV site, if they begin to have swelling, or if the IV site is leaking, or if there is any discomfort. So to tell you right away so you can come back and reassess and make sure and see if in fact there is an issue with the IV. Okay, so I have an order to change from LR to normal saline, so I'm going to the medication room to gather the IV solution that has been ordered. So it's normal saline. I have 500 cc's and expires on December of 2018. Okay, I'm gonna go then to the patient's bedside, and after I wash my hands, introduce myself, and verify the patient identifiers, I'm gonna let him know that I need to hang a new IV bag. So I'm gonna double check to make sure that I have the correct IV. I'm gonna remove from the wrap, and I'm checking again that I have the correct IV. Normal saline 500 cc's. Expiration date is December of 2018, and it's clear, there's no particles. Okay, it's intact, so I'm gonna hang it on the IV pole. Okay, and as I'm doing that, I'm gonna go ahead and pause my machine. I'm gonna bring down my previous IV and remove the spike. Okay, I have my MAR available where I can read and compare. Okay, remove the cap and spike your port. Remember not to contaminate. Okay, it's fully seated. Okay. At this moment in time, I'm going to do my second check. So it is normal saline. Okay, 500 milliliters. Expiration date December of 2018. So it's the correct solution. And once more, before I push the start button, I'm gonna have to go ahead and verify. So it is normal saline, 500 cc's. Expiration date December of 2018. So I push the button. Okay, I stayed with the patient and I verified that the IV site is not infiltrated. There is no tenderness, that there is no leakage or any other issues. I'm going to continue with the IV skills, and this time I'm going to show you how to change a dressing that it's no longer occlusive. Okay, remember that it's very important for us as nurses to monitor the IV site and also to monitor and make sure that this dressing is clean, dry, and intact. Okay, so at any point in time, if the nurse identifies that the dressing is not intact, that there's leakage, maybe that the dressing is all wrinkled, then this has to be changed. Okay, because of that you identify that is no longer functioning, I will need to bring materials to the bedside. First of all, I will need to have, if my patient was to have a hemlock, I will need to have my saline that I'll be using to flush and make sure that my IV site is still patent. If my patient has IV fluids running, then I will have to stop the IV in order to change the dress. Okay, I'll be performing then hand hygiene. I'm gonna put my disposable gloves and I'm coming to inspect again the IV site. So remember, leakage, the dressing that might be wet or wrinkled is no longer acceptable. And what I'm gonna do is I'm gonna remove the kudos in case of a hemlock, or if the patient has a peripheral IV fluids running, then I will have to stop. In the case of a hemlock, I'm gonna show you, we will have to go ahead and clean the port and then flush it. And I am pulling back first to verify blood return. So you see it here, it's perfect, it's wonderful. I'm gonna flush it and I'm looking to see if there's any infiltration or if there's any leakage. So my IV site is intact, there's no issues with it so far. So it means that all I have to do next is I'll dispose this in my sharps container. And what I'm going to do, I'm going to proceed to remove the dressing. So of course you are communicating everything that you're doing with your patient, and you open your alcohol swabs. And then you can begin to remove this dressing. Be careful. Okay, particularly with your older patients that have very fragile skin. Okay, you might want to go ahead and just remove slowly, and then you see that the IV site is still intact. Okay, so I'm almost done removing the old dressing. I will dispose this in the trash can. And what I have had ready is a second IV start kit that has our chlorhexidine and a new bio-occlusive dressing. So what is that I'm gonna do? I'm gonna break it, break the seal, and I'm gonna proceed to clean in the same manner as I would do to prepare the IV site. I will allow it to dry. And now that it's dry, I'll have my dressing ready. Remember, slit goes down. Okay. Make sure that it is well secured. Then you're gonna, of course, you're gonna date your dressing again, your initials and the time that you did, and then you're gonna place it where it's not obstructing the IV site. Finally, if you have a hep lock, you replace the kudos cap, and then you document your skill.